Now, so we have discussed the first question. Now we know the cardiac conduction system. We know who is the big boss in cardiac conduction system. We know that everything starts from the SA node. It depolarizes the atria, and then there is a fibrous discontinuity, fibrous connection that separates the atria and the ventricle. Everything comes at the AV node. They wait at the AV node. Once they get permission, then they go down and depolarize the ventricles. Fine. So let's move on to the next question before we move on to the next topic. Now, how do we pick up the electrical activity that is generated by these components of the cardiac conduction system, right? Now, the electrical activity is picked up by placing various electrodes. You must have all seen that in your hospitals. We place electrodes. Now, where are the electrodes placed? One, they are placed horizontally, right? You must have seen people placing electrodes on your chest. Then you must have seen people attaching ECG on your limbs, right? So, they are called electrodes. We're going to discuss that because it is these electrodes that help us capture this electrical activity and then get them printed onto an ECG for us to understand easily, right? So, try and answer this question. While doing an ECG, you attach electrodes to limb, you attach electrodes to chest. So, which of the following is not correct? Be very careful in exam when you're going through these questions, okay? Not correct, correct, right? Not true, not false. So, this is which of the following is not correct. So, basically we have to choose an option that is false. Fine, right? So, the first option is V1. So, V1 electrode is a chest electrode that is placed in the right fourth intercostal space. Is that a true answer? Yes, that's a true answer. V2 is placed in the left fourth intercostal space. I will be subsequently showing this to you in the next few slides. AVR is the augmented voltage of the right leg. AVL is augmented voltage of the left arm. So, answer obviously is this. This is false. Why? Because AVR is attached to the right arm. Okay. Now, so we'll discuss this. Now, before we move on, has it ever occurred to you that we have a total of 10 electrodes, right? You have 6 electrodes on your chest, V1 to V6, right? And then you have 4 electrodes that are applied to your limb, right arm, right leg, left leg. So, there are only 10 electrodes, but why is it that in a standard ECG, you have 12 leads? Yeah, think about it. Yeah, 10 electrodes, but 12 leads. Fine. If you have gone through all the standard leads, there are 3 leads here, limb leads, 1, 2, 3, then there is V1, 2. So, there are 3 leads here, then AVR, AVLF, AVF, 3 here, and then 6 chest leads. So, that's 12, but although we have only 10 electrodes. So, we will try and answer this question too. Fine. So, the basics to understand before we move on to understanding the ECG is electrodes. So, what are these electrodes? Electrodes are basically selfie cameras. There is a trend in the current generation to take a lot of selfies. If you're on Insta, if you're on FB and many other social media platforms, you have people taking selfies from different angles. Why do they do that? They do that to get the best profile of their face, right? Sometimes you take it from this side, sometimes you take it from the front, sometimes you take it from the top, right? So, various angles. Your heart is no different, it also wants that attention. It wants its best view to be presented on the ECG. So, how do we take that? So, the selfie camera is what is electrode. So, that's its function, to take pictures of the heart from various angles, right? Now, when you combine the images or when you combine the electrical potential from 2 of those selfie cameras, it forms a lead. Got the point? It's just like the panorama view in your camera. You take multiple images, the camera processes it and it gives you a long image, right? The same thing happens in the ECG. The electrodes from different angles take multiple images and they get combined, they are sent to this smart ECG machine which converts it into a lead and gives you an image, right? Now, the electrodes are single position things like V1, V2, V3, V4, V5, V6, AVR, AVL, AVF, and when you have a difference or when you combine 2 of these electrodes, it makes a lead. So, that's the difference between electrode and a lead. Now, the second important basic concept to understand before we move on is number 1. Now, focus on the diagram here. before we move on the focusing this diagram, I just want you to imagine yourself standing in front of a railway platform and a train is approaching you. What happens when the train is approaching you blowing the horn? The nearer it comes to you, the louder you hear the sound, right? The farther the train goes away from you, the lesser you hear the sound. Similar principle is what happens when electrical impulses come either towards the electrode or move away from the electrodes. So when any electrical activity moves towards an electrode, it produces a positive deflection, right? Just focus once more. So you have an electrical activity that's moving towards a positive electrode. On the galvanometer, this would produce a positive deflection, and what you would get is a positive wave. So when you get a positive wave in the ECG, it means that the electrical activity was moving towards the positive electrode, right? Now, it's just like the train coming towards you. Yeah, you hear the sound more. Now then concentrate on the second diagram. If you have electrical activity moving away from the positive electrode, going towards the negative electrode, you get a negative deflection, right? The galvanometer moves towards the negative side. It's just like the train leaving the platform. The sound subsequently decreases, right? So once we know these three basic concepts, one, that electrodes are cameras, yeah? They take beautiful selfie pictures of the heart from different angles. The AVR takes it from this angle, the AVL takes it from this angle, the AVF takes it from this angle, all three in the vertical plane, and the chest leads take it from the horizontal plane, right? So they are cameras. And when we combine impulses from two electrodes, when those impulses go to the ECG machine, data from two electrodes are combined to give a common data through a lead. So two electrodes potential is converted into a lead, right? The third basic point is anything that moves towards a positive electrode, positive deflection. Anything that moves towards a negative or away from the negative electrode, negative deflection. Right. Now, one of the things that I asked you was, that there are only 10 electrodes, but why are there 12 leads? Now, the answer to that is because the other two leads or the three leads come up because we combine data from these electrodes. So, in an ECG, standard ECG, there are 12 leads. Which are the 12 leads? There are horizontal and vertical leads. So, as I told you, the idea of having these leads or electrodes is try and get the best picture of the heart. So, what is done is we place leads or electrodes to get horizontal view as well as a vertical view of the heart, so that we see the heart from both the angles in both the dimensions. Fine. So, the standard leads that are available in ECG are 6 precordial leads. I am sure you already know about it. V1, V2, V3, V4, V5, V6, and then 6 these leads look at the heart in a cross section, horizontal plane. Then there are 6 leads that look at the heart in the vertical plane, right? There are 3 standard limb leads and 3 augmented limb leads, which we will be discussing. Fine. Now, the beauty of these leads is that whenever there is an electrical potential moving from one of these electrodes to another of electrodes, we can represent them as vectors. You are all aware of vectors, right? Simple arrows from one point to second point. Fine. So, when we connect two electrodes, when there is electrical activity moving from one to another, that can be represented as vectors. And using these vectors, what has been created is a hexaxial reference frame. Fine. So, using these vectors, we can measure the electrical axis of the heart. Now, if you remember the previous few slides, I had shown you that the electrical axis of the heart is where the depolarization moves, and it's towards our left and downward. But can we measure it? Can we give it an angle? We say that it is 90 degree, is it 120 degree? How is that done? Is by making a hexaxial reference frame using the vectors. Now, to understand that hexaxial reference frame, we have to understand this Einthoven triangle. Fine, because this is a triangle formed using all these vectors.